Insulin lispro, also known as Humalog Vial, is used to control high blood sugar in people with diabetes. This helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems, as well as lessen the risk of a heart attack or stroke. It is a man-made product that is similar to human insulin, replacing the insulin that your body would normally make. It starts working faster and lasts for a shorter time than regular insulin, helping blood sugar get into cells so your body can use it for energy. This medication is usually used with a medium or long-acting insulin product, and may also be used with other oral diabetes medications. It is important to follow a proper diet and exercise program while using Humalog Vial. The dosage and timing of this medication will depend on your individual needs and should be determined by your healthcare provider. Before you start using this medication, make sure to read the patient information leaflet if available from your pharmacist. If you have any questions, ask your doctor, diabetes educator, or pharmacist. Be sure to learn all preparation and usage instructions from your healthcare professional and the product package. Check the insulin for particles or discoloration before using it. If you see either, do not use the insulin. It should be clear and colorless. Clean the injection site with rubbing alcohol before injecting each dose. Change the injection site each time to lessen the risk of problems or damage under the skin. You can inject this medication in the stomach area, thigh, buttocks, or back of the upper arm. Do not inject into red, swollen, itchy, or damaged skin. Avoid injecting cold insulin because it can be painful. The insulin container can be kept at room temperature. Inject this medication under the skin as directed by your doctor, usually within 15 minutes before eating a meal or immediately after a meal. Do not inject into a vein or muscle as it may cause very low blood sugar, hypoglycemia. Don't rub the area after the injection. If you are directed to inject this insulin with an infusion pump, read the instruction manual and avoid exposing the pump or tubing to direct sunlight or heat sources. Do not dilute insulin if you are using an insulin pump. This product may be mixed only with certain other insulin products such as NPH insulin. Always draw the insulin lispro into the syringe first, then follow with the longer-acting insulin. Do not mix different insulins and do not mix insulins if you are using an insulin pump. Follow your doctor's directions on the dosage and measure each dose very carefully. Check your blood sugar regularly and use this medication at the same times each day to get the most benefit from it. Tell your doctor if your condition does not improve or worsens. Some common side effects of Humalog Vial include pain, redness, irritation at the injection site, and weight gain. If these effects persist or worsen, it's important to notify your doctor or pharmacist. This medication is prescribed because the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to seek medical attention if you experience signs of low potassium in the blood or symptoms of low or high blood sugar. Low blood sugar symptoms include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. It's important to carry glucose tablets or gel to treat low blood sugar, or consume a quick source of sugar like table sugar, honey, or fruit juice. To prevent low blood sugar, it's important to eat meals on a regular schedule and not skip meals. Symptoms of high blood sugar include increased thirst and urination. If you experience these symptoms, it's important to notify your doctor. Additionally, seek medical help right away if you notice any signs of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Remember to discuss any concerns or questions with your healthcare provider. Before using Humalog Vial, make sure to inform your doctor or pharmacist about any allergies you may have to insulin or other ingredients in the product. Also, let them know about your medical history, especially if you have kidney or liver disease, or thyroid problems. Be cautious when using this medication, as it can cause low blood sugar. You may experience blurred vision, dizziness, or drowsiness, so avoid driving or operating machinery until you are sure you can do so safely. Limit alcohol consumption while using Humalog Vial, as it can increase the risk of low blood sugar. Stress, such as due to illness or surgery, can make it harder to control your blood sugar. Be sure to consult your doctor in case your treatment plan needs to be adjusted. If you are planning to exercise or travel across time zones, speak to your doctor about how to adjust your insulin schedule and whether you need to take extra insulin and supplies with you. Older adults and children may be more sensitive to the side effects of this drug, especially low blood sugar. If you are pregnant or breastfeeding, discuss a plan with your doctor for managing your blood sugar, as pregnancy may cause or worsen diabetes. It's important to be aware of any potential drug interactions when using Humalog Vial. Certain medications, such as beta blockers and glaucoma eye drops, may affect how your body responds to low blood sugar. This can make it more challenging to control your blood sugar levels. Be sure to keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. They can advise you on how your medications may affect your blood sugar and whether any adjustments are needed. It's also important to regularly check your blood sugar levels and report any symptoms of high or low blood sugar to your doctor. Additionally, if you are using insulin lispro, do not use insulin lispro ABC at the same time. Talk to your doctor about the best time to take this medication and any concerns you may have about its use. If someone has taken too much Humalog Vial and is experiencing serious symptoms like passing out or difficulty breathing, it's important to call 911 right away. Otherwise, contact a poison control center immediately. In the US, you can call 1-800-222-1222 for your local poison control center. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include signs of low blood sugar such as sweating, shakiness, loss of consciousness, and a fast heartbeat. It's important not to share your Humalog Vial, needles, or syringes with anyone else. Make sure to attend a diabetes education program to learn more about managing your diabetes with medications, diet, exercise, and regular medical exams. Learn the symptoms of high and low blood sugar and how to treat low blood sugar. Check your blood sugar regularly as directed by your doctor, and make sure to share the results with them. While taking this medication, you may need to undergo lab and/or medical tests such as liver and kidney function tests, fasting blood glucose, hemoglobin A1C, and complete blood counts. It's important to keep all medical and lab appointments. Also, it's a good idea to keep extra supplies of insulin, syringes, and needles on hand in case you need them. Remember to consult with your healthcare provider for the daily dosage and optimal timing for taking this medication. Remember, it's crucial to stick to your insulin schedule as prescribed by your doctor. If you happen to miss a dose, make sure to consult with your doctor beforehand on the appropriate steps to take. When it comes to storing Humalog Vial, it's important to keep unopened insulin products in the refrigerator. Once opened, the insulin lispro vials can be stored in the refrigerator or at room temperature. However, opened insulin lispro cartridges and pre-filled pens should only be stored at room temperature and not refrigerated. Remember to throw away any insulin lispro that has been in use for 28 days, even if there is insulin left, and discard all insulin products after the expiration date on the package. It's also crucial to avoid freezing insulin and never use insulin that has been frozen. If you're using Humalog Vial in an insulin pump, make sure not to store the drug in the pump for more than 7 days, as doing so may lead to ineffective treatment and high blood sugar. Keep the insulin in your pump away from direct sunlight and temperatures above 98.6 degrees Fahrenheit 37 degrees Celsius. To maintain the effectiveness of the medication, protect Humalog Vial from light and heat, and avoid storing it in the bathroom. It's important to keep all medications away from children and pets and properly dispose of the product when it is expired or no longer needed. Be sure to consult your pharmacist or local waste disposal company for proper disposal instructions. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.